There was a period of time in the 1980s when we talked about community health planning, when we worried about what was best for the community. The problem is that there are many people who don't have insurance, and they aren't part of that system, and they need someone to give it to them, or they can't have health care. And the problem has gotten a lot worse lately. It's a different problem today, although some of the same issues are there. It's cost, it's quality, it's access, but it's not the same cost and it's not the same quality. It's a different question.
Many times I see patients who aren't getting access to care and aren't getting the kind of medical care they need. Oftentimes they're young women who need prenatal care, or older men or women who need diabetic care and regular control. Women are starting to lose their insurance at a faster rate now than they did 15 years ago, and they're the fastest growing group in the uninsured right now.
A disproportionate amount of Medicare dollars, some estimates are around 2/3 of Medicare dollars, are spent in the last months and weeks of elderly patients' lives. This is money that could have been spent on preventive services and other services that have a greater impact on quality of life for the elderly. Health policy is a process by which we try to take our collective values and turn them into rules and regulations and ways to shape the industry.
I think the single thing it takes is a full discussion around our communities to talk about this issue. I think we've buried it in the legislature, we've buried it in other places, and it's time for us to talk about it. Just what is our contract with each other? What is my duty toward you? What is yours toward me? What is a community about?
I just really don't know what to do. My husband's doctor wants me to make a decision, and I can't. But I don't know if our insurance covers this, and I don't know where I'd get the money if it doesn't. And I don't know what to do.
The issue of who pays for what is very complicated, and that's one of the dilemmas, is sometimes there's nobody who knows who's paying for it.
Very few of us really pay for the majority of our care out of our pocket.
A consumer doesn't know up front. I mean, when you're paying for it out of your own pocket, you know how much money you have, you know how much you're willing to spend for something. When somebody else might or might not be paying for it, it's very difficult to make those decisions.
I believe the way we have to pay for health care has to change. I don't think the system of being employer-based is working any longer. We find that almost all of the new businesses that have started up in our state in the last couple of years don't offer health insurance anymore.
The problem of uninsurance or underinsurance or gaps in insurance coverage in transition periods is clearly not just a problem for low-income people. It's a problem for everybody.
Now we're seeing middle-class folks who have been gainfully employed all these years, live middle-class lives, and now are having to not only turn to public health for care, but even do things like go through food banks.
When you have a system where 2/3 of the people get their insurance through the employment system, and the employment system is in complete chaos, that doesn't work very well for something as important as health care.
Is there some floor that every human in the state of Washington ought to have as coverage? Do we think the workers who have to pay Social Security and cover us when we're older and make the society productive ought to have health care as a basic right?
I have an overweight, middle-aged, hardworking, daycare worker, diabetic, hypertensive person who needs about 5 drugs to control her blood pressure and her diabetes.
Prescription drugs are so expensive, whether someone's on 1 or 10 to manage their multiple conditions, whether it's depression, arthritis, diabetes, any number of the big ones, congestive heart failure. The issue is that they're on a fixed income. These folks are not out there working and don't have health insurance through any other means.
What happens to people who find themselves in trouble without the resources to get themselves out of trouble?
When she goes through all of the funding for her prescriptions, what she has to do is come down to my office and beg for help to get the rest of her drugs for the rest of the year for free because her benefits have expired.
They have to make choices about whether they pay their rent or whether they buy their prescriptions.
People should not lose their homes in order to get the health care they need.
What does fairness mean across all these different groups?
The chain smoker puts away 5 packs a day. We know very clearly that there's a great risk that person will come down with a whole host of diseases. What obligation do I have to help pay for their health care?
We as a society have an obligation to treat folks, regardless of whether it was self-abuse or what. I mean, we do have an obligation.
The problem comes in deciding how much of my goods I'm willing to devote to the care of a person who doesn't seem to care that much about himself.
We have to balance that off about how we view our own freedoms. Do I want to be told not to smoke?
Rather than catching patients down the stream, go upstream. Go upstream and start the prevention. Start the education. Look at why they're abusing their bodies.
What's my personal ethic? How much altruism do I have?
How can we ever say that a child doesn't have the right to the best health care available? How do they learn if they come in, if they don't see well, if they don't hear well, if they have some kind of nagging problem that could be fixed?
There is an element of fairness we have to develop in our system. We can't just leave whole classes of people out because they're not either economically powerful, because of their racial background, because they work for certain people or certain groups or for certain companies.
Gosh, where would we draw the line between categories? How big a program would they be eligible for?
The use of medical services, do we use them right? Do we use too much? Do we use too little?
When we didn't have transplants, nobody expected to live with kidney disease. And so there wasn't this angst over, shall I put my family's finances in ruin in order to have this transplant? So we have all kinds of values, ethical, moral issues that we have created for ourselves because of the wonders of technology.
If we're living a long time and we have multiple chronic conditions, who's going to pay for the medications?
Beyond my primary care, how do I get to a specialist? Do I refer myself? Does someone else refer me? Who has to monitor that?
I go to see the doctor. I go 8 in the morning, 2 o'clock. I spend 4 hours, I don't see the doctor. And goodbye.
All of those things are choice points. And we simply have to decide where are the most important ones.
The healthcare system is filled with altruistic people who want to help, but the structure of the system is driven like any business.
I think the only way it's sustainable is if we grapple with some very hard issues that are, I think, broader ethical issues in our society. We have to grapple with the whole idea of appropriate use of services. We have to grapple with the idea of, do I depend on the healthcare system to make me healthier?
I also feel that everybody should have some minimum care. Both medical and dental. I'm really a radical.
We know that in America, aggressive activists do have the power to get things done in healthcare delivery.
I can see us making huge gains in the future around this area. I know we cannot do it without people being involved more broadly than the public policy experts. There's no way the public policy experts can solve this. But I have great faith in humans, in the American people.